treatment after diagnosis seems to be inconsistent in areas. She was personally directed to the NeuroSymptoms website and left to deal with it alone. How do you go about requesting help?
Yeah, well, I'm really aware that things are improving, I would say, particularly in the UK, but there's still in most centres around the world, this is not a condition that neurologists are that interested in. I think for most neurologists, they would recognise it, but they would not feel very confident in explaining it, and not feel confident in, or feel that even if it was their responsibility to manage it. Now, I think that's wrong. I think we need to change that, and that's my view and many others. But unfortunately, the way things are, there are many patients with FND receiving poor treatment, I think, around the world. So I agree that if you just said, here's your diagnosis, here's a website, off you go, is not enough. You can't, that's a big website. It's got lots of, descriptions of all sorts of different things on it, as has yours. Where do people start? These are resources of information to assist people. They're not treatments in of themselves, I think, for most people. So it's a case of trying, if you can, to find someone who wants to treat you, and maybe insisting with your healthcare professional that you want to have treatment for your functional disorder. They may, one of the reasons health professionals are reluctant is they're worried that they're going to upset the patient, or the patient will be angry. And sometimes if they're met with a patient and say, look, I've got FND, please can you help me with this? A lot of health professionals might be it might help. So it's worth thinking about that, changing the conversation.
We found too that a lot of the apprehension is not that they don't want to help, is that they don't have the tools. And
yeah.
And I think, one, sometimes helping them find the tools and bringing them to them. There's some online things. There's the conference that we recently had. There are some resources out there. So I think sometimes just kind of being patient with them as they're learning as well.
I think that's great advice. And saying to somebody, look, I've got this problem. Can you direct me to a physiotherapist who's got expertise in this condition? Or if you've got seizures, do you know any therapists who've got experience of treating this? Because I'd really like to meet one. I think there is a sort of lack of training in this area, and many doctors, unfortunately, tend to think, well, I don't really know about this. It's not really my problem. But actually, when they become interested and they know about it, it's actually rewarding for doctor and patient. So it's a win-win, I think, potential out there.